Mr. President.
The senator from Connecticut.
Thank you very much, Mr. President. Thank the colleague for yielding. Mr. President, good friend from Wyoming was on the floor yesterday. I believe he's a frequent critic of the Affordable Care Act, and he made a pretty simple point that was reported in the press yesterday, critical of the administration for holding so many events talking about the success of the Affordable Care Act. His suggestion was that we shouldn't be celebrating, the administration shouldn't be celebrating the success of the Affordable Care Act in terms of the number of people who are gaining access to it, the stabilizing cost curve of healthcare expenditures all across the country, and the number of people whose emotional well-being is just much better today because they don't have to worry about ever losing their health care simply because they get sick, or losing all of their savings simply because their child comes down with an expensive illness. Mr. President, I guess I would beg to differ, because I talk to people all across my state of Connecticut who are celebrating today because the ACA works. They're celebrating because their lives have been transformed by the fact that we now have finally made a commitment as a nation to make sure that if your son gets sick, that you won't lose your savings, your college 529, your house, your car, just because of an illness. I think that the Affordable Care Act is something to celebrate, because a lot of my constituents believe the same thing, like Betsy from Litchfield, Connecticut. She said that without the Affordable Care Act, she would not have health insurance at all due to her pre-existing condition. 1 month before the ACA was implemented, she was sick with stage 4 cancer, and her insurance company gave her 2 weeks' notice that it was going to end her coverage early. Luckily, Betsy was able to resolve that issue, but she says, quote, "The bottom line is that before the Affordable Care Act, health insurance companies could and did kick sick people off their insurance rolls, and pre-existing conditions left many uninsured indefinitely." She says, "If you're not insured and have to pay the outrageous cost of U.S. health care out of pocket, you will quickly spend down all of your retirement savings and possibly have to sell your house to boot." This was the situation I was facing in December 2013, and it was an unsettling prospect. Or Linda from Winsted, Connecticut, who says that she's grateful for affordable health care because she's got multiple chronic illnesses like diabetes, hypertension, osteoarthritis. She was unable to buy health insurance at any price because the insurance companies were charging her more because of her pre-existing conditions. In Linda's view, this issue boils down to people having basic rights, the freedom to be healthy, the freedom for her to live a life in which she knows she's going to be able to afford coverage for herself. She said this in an email to me, quote, "There is no freedom in poverty, and certainly none in needless human suffering." So Betsy is celebrating today. Linda is celebrating today. And there are millions others like them all across the country who know that the Affordable Care Act is working. But it's not just those individuals, it's newspapers from the New York Times to USA Today to the Washington Post on down who are saying with a clear voice that the Affordable Care Act has achieved nearly all of its ambitious goals. 11.4 million Americans are now signed up for health care. This is a success story all across the country. But, Mr. President, a success story that is at risk. At risk because of a Supreme Court which is considering an evisceration of the Affordable Care Act that would be a stunning act of judicial overreach if the plaintiffs were to succeed in the King v. Burwell case. Their contention is simply this, that it was the intent of Congress to only provide insurance subsidies to states that had state exchanges and not federal exchanges. I haven't found a single senator or representative who voted for that law who says that it was their intent to punish states that didn't establish state exchanges by withholding subsidies from millions of Americans. And in fact, there is no way to plainly read the statute without coming to the conclusion that subsidies were not just intended, but written into the law to go to every single state, no matter what kind of exchange they decided to establish. The law says that because it specifically states that states that don't choose to set up their own exchange will have a federal exchange take the place of that state exchange. But the totality of the law is clear as well. If the federal government had intended to set up give subsidies only to states that had state exchanges, they would have also made the insurance reforms contingent upon those state exchanges being established. Instead, the insurance reforms are nationwide, meaning that clearly the statute was set up to make subsidies nationwide, because the insurance reforms cannot exist without those subsidies being available to people to be able to buy affordable insurance. And it's not just the individuals who voted for this law who are clear that subsidies should be available. It's the Congressional Budget Office. The Congressional Budget Office reads statutes we passed, independently interprets them, and then assesses a cost to the laws that we passed. Well, Doug Elmendorf was before the Appropriations Committee yesterday, and I asked him a simple question. When you independently reviewed the Affordable Care Act, did you come to the conclusion that it allowed for subsidies to go to state and federal exchanges? His answer was clear. Yes, we read the Affordable Care Act as to provide insurance subsidies to both state exchanges and federal exchanges, and thus we priced the bill accordingly. The law is clear. The law's intent is clear. The voices of those that voted for it are clear. The independent Congressional Budget Office is clear. The Affordable Care Act only works if subsidies flow to both states that have federal exchanges and states that have state exchanges. And for families like those of Betsy in Litchfield, Connecticut, and Linda in Winstead, Connecticut, to continue celebrating the success of the Affordable Care Act on the ground floor for the millions of lives that have been transformed, then this body needs to continue to stand up for the premise that the Affordable Care Act continues to work. That, Mr. President, is absolutely something to celebrate. I yield the floor.